Oh, I've just had this headache and I can't get rid of it. And it feels like my head is pounding. But, excuse me. That's right, migraines. They're terrible. What are they? How do you prevent them? And what can you do to take care of them? Join us. Welcome back, everyone. I'm trying to reenact something, but every single one of you guys have probably had headaches. And there's a particular type of headache called a migraine, which is a very common neurological phenomenon and starts with heavy pounding and throbbing. But that's actually not where it starts. For the people who suffer from it, including my wife, they go through sheer agony, and it can last for days sometimes. So let's talk a little bit about migraines. Migraines are a common neurological phenomenon, which is divided into a number of different types of migraines. So there's actually 150 types of headaches. And any good neurologist will tell you that they're kind of divided into primary and secondary headaches. A migraine is a primary headache, meaning that it isn't caused by different medical conditions, but it relates to the brain itself. In most migraines, in the classical form, they're divided into 4 different stages. And the first is a prodromal, where the symptoms can be very nonspecific. You can have yawning, restlessness, anxiousness, and that lasts for about a day or 2 before the actual event. Then in some people, you have something called an aura, where you may have a visual field defect, you may have some numbness or tingling, or you may have other sensory deficits, or you just may feel unusual. That usually lasts for about an hour. And then finally, there's the actual headache, which comes on. And that's characterized by a throbbing headache, usually in the frontal region, but it can be on one side or the other. Now, the interesting thing is that can last up to 72 hours, but is often 4 hours or less. And when it happens, the biggest problems you get with it are nausea and vomiting, as well as the fact that you can't tolerate light or sound or other types, and you're very sensitive to other types of inputs. It is very debilitating. And interestingly enough, in the US, up to 12% of people will have migraines in their lifetime. Its typical age onset is in the mid-teens, and it peaks in the 30s, but it can go on to up to the 50s. And it's most often seen in women in a 3-to-1 predilection. Now, the interesting part is that if you talk to most migraine sufferers, it becomes apparent that 80% of them will have first-degree relatives who have had migraines before. And further, that when they start having migraines, in the women, it's often related to the menses, often related to other hormonal issues, but we actually don't know completely how it occurs. That's interesting because it was thought to be related to vascular instability with vasodilation in the brain. Now what we're finding that it can be related to calcitonin gene-related peptide being secreted by the trigeminal nerve, which causes arteries and veins to dilate in the brain, causing this headache. So the question is then, how do you think about this? And I will tell you that most people who have had migraines will have at least one trip to the hospital or at least to the neurologist, and will undergo a combination of an MRI or CT scan, as well as a thorough neurological exam, because some of the symptoms initially will present in the aura stage, if you get auras, as similar to other maladies which are more worrisome, like strokes and whatnot. But here's the key, right? Only 25% at most will have classic migraines. 75% of people just have the headaches and don't really have all of the phases of a migraine. And so it's not absolutely clear, and if it persists, then you need to see a neurologist. If you get a headache, which many of us do for various reasons, and it recurs again and again, and you find that there's trigger points. And so what are the triggers of migraines? They can be extreme light, dehydration, sleepless nights or lack of sleep. They can be timings in the month for women associated with their menses. It can be related to other findings like different types of food. In many cases, bananas will trigger it, but there may be other types of food which do as well. If you find that with these triggers, you tend to get all of the symptoms recurrently, that's a pretty good indication. But the main thing is that if you're getting symptoms which are more worrisome, like a headache which is beyond belief and is the first time and suddenly comes on, or you're getting paralysias or unilateral sensory deficits or inability to speak, dysarthrias is what we call them, sort of like what I just did, then you need to go see a neurologist and or go to the nearest OPD or emergency room, because that is a worrisome sign. Additionally, if you're getting headaches with nausea and vomiting, which you've never had before, you need to go in. So those are the things where I would say go in once, get it diagnosed. Now you know you've got migraines because they occur on an ongoing scale. What do we do acutely for them when you get them? And what do we do chronically or preventatively for them? On the acute level, there's several forms of treatment which can be placed. From the simplest, in staying in a dark room, using cold compresses, basically trying to get the sound out and all of the stimulation out and just sleeping for a while. That oftentimes is where it starts, but it often doesn't give you complete relief. You can escalate that to standard over-the-counter pain relief in the way of non-steroidal anti-inflammatories or acetaminophen or paracetamol, which sometimes work. Then beyond that, there's a class of drugs called the tryptophans, like sumatriptan and whatnot, which can basically work on reducing the effects of the migraine and potentially stop the migraine. Now, those were used classically, and they do tend to work. They have side effects in the way of sometimes causing nausea and vomiting, and they don't always work. There's others like Migrainil, which was prescribed on an ongoing basis, and if taken early in the migraine, can lead to relief. But frequently, if it's taken later, it really doesn't give you much. There are a new class of medications called CGRPs, which is calcitonin gene-related peptide inhibitors, or calcitonin-related gene peptide analogs, which bind to the receptor and prevent the trigeminal nerve from stimulating and vasodilating the brain vessels. And these more recently have been shown to act acutely to actually stop a migraine within 2 hours of taking it. And so we'll have to see if they're universally available, but they may be the best solution and a better treatment than what we have out there. And then beyond that, there are some other types of treatment in the way of biofeedback, in the way of meditation, and these have not been studied extensively in terms of long-term studies seeing relief, but anecdotally have been described in many patients to give you some relief. How do you prevent migraines? That's another great question. And the idea is preventing migraines is knowing what causes them, meaning what are your triggers. If you can stop the migraine by preventing it and reducing your trigger points, meaning sleeping on time, having enough water on board, perhaps taking different medications to moderate your cycle, your monthly cycle, or doing other things, that is sometimes an adequate means to do it. The interesting part in women is what they notice is postmenopausal women tend to have their migraines get better. And in most cases, though it starts early for women in the teen years, it often ends after they become postmenopausal. But it can get worse sometimes with childbearing or with menses or whatnot. Now, what are the other things you can do to prevent it? From a pharmaceutical standpoint, there are medications which can be given. In the classic day, when we had originally learned it, beta blockers and calcium channel blockers were often given with the thought that they would stabilize the vascular bed. But more recently, they actually have monoclonal antibodies from the CGRP, the calcitonin-related gene peptide, or calcitonin gene-related peptide, which, if given on a monthly basis, will potentially prevent migraines. Now, the interesting part with that is you need to go to a doctor regardless, and that needs to be done for people who are having recurrent migraines, which are debilitating. And migraines generally are debilitating, but in these patients, they have them recurrently, and they really can't make head or tail of their lives because of the disabling effects of the migraines. Additionally, in the past, they have prescribed some anticonvulsants, they've prescribed some antidepressants and other things, but I would say that we're moving forward with therapy. The last thing is that we know, or we think, that it may be genetically related because it has a very high hereditary factor. And so if you have a first-degree relative in 80% of the cases, you know that they're going to end up identifying a gene which is related to this. And at some point, we may be able to intervene. Perhaps that's the CGRP receptor or something in that in terms of hypersensitivity. Finally, the thing I would say is migraines are part of life. The prognosis is not poor if you can put in preventative strategies and use some of the techniques we've talked about in terms of treating them acutely. The main thing to understand is that they may be self-limited with age. As you get older, particularly in women after their postmenopausal years, the migraine frequency and severity may go down. The second thing is that while they're not curable completely yet, so that you never have another one, they are treatable by treating the preventative factors, the triggers, in other words, and also when you get a migraine, treating it acutely. So I hope that helps you for all the people who suffer from migraine, because I know I live with someone who has them, and she suffers through them, and she's incredibly brave and strong about it, but I can tell you how much suffering there is. And so if you have any questions, please leave them in the comments. I've left the links for this talk in the description. And, just so you can follow me, please hit the subscribe button, share this with all your friends, hit the like button if you like this, and hit the follow button with the bell icon so that you can see my new talks coming out, because we're constantly trying to figure out things which will help people to live their best lives. Anyway, thank you so much for joining me, and I appreciate your time.